so we've got a very interesting case on the table this morning. It's a functional rhinoplasty. He's got two issues. The one is he can't breathe through the right side of his nose, and the second one he's got left valve collapse, so the left side sucks in when he breathes in. So if you have a look at the CT scan, you can see as we come up here, there's an extremely deviated septum with a septal spur. As you can see like that. And then if we come from the front, you can see the right-hand side's blocked, the left-hand side's open. And as we come up there, you can see there's the spur coming out on the opposite side. So we're going to be fixing him. I'm going to show you on the stack before and after. Okay, so we finished the case. I'll show you now with the camera what it looks like, but the important thing is that we had to do is first remove the septal deviation and the septal spur, then re-approximate the septum to the right of the anterior nasal spine and the maxillary crest, and then I actually had to use some vomer bone, which I drilled through little holes to actually straighten that out completely. So everything's straight now, I'll be able to breathe better. Last thing I'm going to do is I'm going to be putting bilateral Doyle splints in for 2 days, and I'm going to be putting bolter dressings on the side because we actually did turn under flaps of the lower laterals to stop the valve collapse on the left-hand side.